morning, friends. Today I thought that I would discuss a broad outline on hypothyroidism because we have been looking at diabetes almost all the time and the complications associated with diabetes, especially the vascular complications, heart issues, kidney issues, micro issues in the heart and the kidneys, and eyes, various things. But then you got to realize that almost next very common disorder in our country especially is hypothyroidism. That is thyroid gland, the reduced secretion of thyroid hormone. See, இது வந்து மூணு டைப்பாக இருக்கலாம் because the thyroid gland secretes the hormone which is necessary for various activities, including growth, development, intellectual growth, எல்லாமே and various other. இது வந்து வாட் ஹேப்பன்ஸ் இஸ் ஃபஸ்ட்டு வந்து பிரெயினில் ஹைப்போதலமஸ்னு ஒரு ஏரியா இருக்குது. அதில் வந்து தைரோட்ராபின்னு ஒரு ஹார்மோன், ஐம் நாட் போரிங், ஐம் ஜஸ்ட் கிவிங் அன் அவுட்லைன், செக்ரீட் ஆகி இது வந்து ஆன்டீரியர் பிட்யூட்ரின்னு பிரெயினில் இன்னொருதில் தைராய்டு ஸ்டிமுலேட்டிங் ஹார்மோன்னு ஒன்று இருக்குது. திஸ் ஸ்டிமுலேட்ஸ் த தைராய்டு டு செக்ரீட் இது ஹார்மோன். ஸோ நார்மலி தைராய்டு கிளாண்ட் செக்ரீட்ஸ் ஹார்மோன் அக்கார்டிங் டு த பாடி நீட்ஸ். What happens is three types of hypothyroidism. Very common is primary. Primary being from the thyroid gland hormone levels are reduced, secretion is reduced. So this is most common. And the commonest cause of this is one, very common, iodine deficiency. Second one, the subclinical pregnancy, subclinical hypothyroidism. I'll talk about that. அது மாதிரி பார்டர் லைனில் இருக்கிற ஹைப்போதைராய்டிசம் காஸ் பண்ணிவிட்டு ப்ரோக்ரஸ் ஆகலாம். தட் இஸ் ஆட்டோ ஆன்டிபாடிஸ் ஆர் ஃபார்ம்ட் அகேன்ஸ்ட் த தைராய்ட் கிளாண்ட். சி, ஆன்டிபாடிஸ் ஆர் ஃபார்ம்ட் இன் த பாடி அகேன்ஸ்ட் ஃபாரின் சப்ஸ்டன்சஸ் லைக் ஒரு வைரஸ் enters into the body, bacteria enters into the body fights that and destroys. In autoimmune disorders, what happens is, like thyroid, what you call Hashimoto's thyroiditis and all that, antithyroid antibodies are produced. They gradually destroy, inactivate the gland or destroy cells. Hormone levels are decreased. So this is the second important cause. So what happens when the thyroid hormone is reduced? It stimulates the brain. So the thyroid stimulating hormone is secretes more. It secretes more thyroid stimulating hormone to stimulate the thyroid to secrete more thyroid, T3 and T4, so that the balance is maintained. This the whole control is like the central control in the hypothalamus by the thyroid hormone. So this is called primary. Then the middle pituitary இருக்கிறது வந்து அந்த thyroid stimulating hormone is called secondary. Secondary hypothyroidism, this thyroid stimulating hormone does not act sufficiently to increase the thyroid production. Third is damage, hypothalamus damage, thyrotropin, this thing. That is tertiary hypothyroidism. So basically what happens is in hypothyroidism, hypothyroidism is a slow, it reduces the slowness, causes slowness of the body. Overall, what happens in this thing is there is gradually weight gain. There is poor appetite, but weight gain. And tiredness, feeling of weakness, tiredness. And the other features will be sometimes due to excessive stimulation by the thyroid. This is not secreting, this is stimulating more and more, glands become bigger, like exercise. You develop a goiter. And there can be later on hoarseness of voice. Voice can become very hoarse, like that, even in females sometimes. That is untreated hypothyroidism. Then when you look at the body as a whole, from the brain you can see that there is reduced concentration, memory disturbances can be there. Then hearing can be affected, poor hearing. Then there is muscle weakness, and there is delayed response, what we call an ankle response. It is slow, jerk is slow, delayed. And there can be hair loss. When you look at from the head, there can be hair loss. And when you look at the heart rate is low. heart rate is 60, 65 in a normal person, even on walking exercise and all. And sometimes fluid collection over the heart, pericardial effusion can develop. In the lungs, a similar situation like breathing difficulty can happen even at minimal exercise without any heart problem, without much lung problem, weight gain, and other things. You'll have to look at this thyroid issue. Then, like in the heart, there can be collection of fluid in the lungs called pleural effusion. Then, stomach, when you see, it can be ascites, fluid collection can happen. Swelling in the legs and all can happen due to this thing. Slowness of reflexes, paresthesia, like in diabetes, you get a sort of the sensation of numbness or pricking, or those sensations can develop. All these features, and gradually as time goes on, they can get a swelling in the back of the neck called buffalo hump-like features. These are features which are common to hypothyroidism. This is what we see. What the patient complains of is feeling cold. Even in warm temperatures, they'll start feeling cold. No appetite, weight gain, tiredness, weakness of this thing. Then constipation. They'll feel constipated unduly. There is no other cause of this thing. Hair loss, excessive menstruation, females cause excessive bleeding can be there. Menstrual bleeding. So when patients in the pregnancy related around before menopause, they complain of excessive bleeding. There is no fibroid, no other cause of this thing. Have to check for a thyroid. Then these are the basic features of thyroid. Then what can be the effects of this? Long-term effects of this thing can be intellectual. This thing, the sodium levels can come down in this thing, thyroid. This is very important. We'll have to realize elderly people with low sodium, it can be hypothyroidism. With weakness, they are telling, on and off weakness, confusion in the brain. It can simulate low sodium levels, hyponatremia. So, because sodium levels also becomes low in hypothyroidism. So, that is continuously present in elderly people. Usually, elderly people, thyroid, they are somehow, the sodium levels are on the lower side, especially the cerebral disorders and this thing. But physiologically, they are adjusted. But this has to be kept in mind. If a patient is hypothyroid, then the thyroid levels have to be checked, and then subsequently they have got to be corrected. So, this is something which is very important. Then gradually as time goes on, the lipid profile, cholesterol levels and all can increase, and then this can cause cardiac problems in the long run. On the long run, in the brain, there is another major issue. Sometimes patient can present first with this, what is called myxedema madness. That is, they will start getting confused, irritated, talking irrelevantly, hallucinations, and this can become an emergency. A sudden fall in the BP, they might have to be treated in the ICU. People might not know what the cause is. There is no head injury, there is no stroke, MRI is clear, whatever. Thyroid levels, long term, not treated. But fortunately, of late, we are doing regular screenings, so health checkups include thyroid. So, the incidence of these complications are less. But we have got to remember, one is that improperly managed hypothyroid patient is at a long-term risk of a cardiac problem. If you mean a cardiac vascular problem, like I said in diabetes, vascular problems everywhere can happen. Vessels are the same everywhere. So if one is there, this is there, it can happen on the brain, cerebral ischemia, various other things, slowly over a period of years. So this is one thing which we have got to be careful about. There's something called subclinical hypothyroidism. See, in some patients there will be no other symptoms, only the thyroid stimulating hormone, TSH, can be increased, T3, T4 is normal. So, in such a situation, it is worth observing. There is no point in treating them actively. Except if it's in pregnancy, when you suspect in such patients, we have got to see if there are antibodies against the thyroid. That is why your doctor will say you do this anti-tyrosine peroxidase, antithyroid antibodies, tyrosine peroxidase, thyrotropin, especially tyrosine peroxidase, which are antibodies against the thyroid and gradually reducing the secretion. So this is one thing. And in pregnancy, when you say a value of around 5 of thyroid stimulating hormone TSH is okay. In pregnancy, 50% extra is required. So anything below 2.5, we uh, check up the antithyroid antibodies and then give a small dose of thyroxine, low dose, to maintain the thyroid this thing, because this can cause intellectual damage, physical damage to growth of the child. And one thing we have got to remember is that thyroid is an endocrine problem, which is also diabetes is also an endocrine problem, and many cases of diabetes, especially obese people, invariably we see that 20 to 30% of the Indians have hypothyroidism. About 5% have hyperthyroidism. Hyperthyroidism we can discuss in some other forum, but this is important. And in the screening, when you're looking at it, is we look at the TSH levels first, and then subsequently check on the free T3, T4 levels. And if these are normal TSH high, then your doctor will tell why you have got to do an antithyroid antibodies, or subsequently if there are several nodules, fine needle aspiration biopsy to find out autoimmune thyroiditis, or if any other causes. Rarely malignancy. It doesn't mean that nodule means fear, patience. Somebody will say biopsy, they are afraid cancer. It's not that. It is just like for prostate, you do a prostate PSA from specific antigen. That is just a screening test yearly to pick up. If there is a race, then instead of the medical treatment, go to a surgical management, remove off the prostate. So this is sort of this thing. So this is a general idea of hypothyroidism. Anybody complaining, especially women complaining of weakness, undue tiredness, loss of appetite, loss of hair, excessive weight, when you check up sodium levels are low, concentration is disturbed, then gradually you see swelling of the face, abdomen, breathing difficulty, shortness of breath. When you see the pulse rate, these are signs. What you find, examine are the signs, what the patient tells are the symptoms. And then poor appetite, constipation, weight gain in spite of this, and then tiredness, daytime sleepiness, very important, can be confused with narcolepsy, cataplexy syndrome. They'll be like this and then nod off and then become okay. So that's sort of a sleep. Mood disturbances, mood swings in the long run, excessive menstrual bleeding in a menstruating female. All these together, one has to, rule out hypothyroidism. So very important treatment, your doctor will say, usually is levothyroxine and iodine supplementation. Now, thank God, the government has taken steps. Even in salt, it is iodized salt. And then rest. If you are diabetic, ensure that talk to your doctor and see that your thyroid levels are checked up. Both are hormonal issues. And in thyroid also, the lipid cholesterol levels can increase, cause occlusion, heart, brain, everything over the long run. Added to a diabetic, if he's a hypertensive, then you get the whole lot of complications, which the idea of my telling is that to know about it, not to frighten you, but at the same time ensure that if when you're looking at one thing, look at a person as a whole, all these connected disorders, including hypertension, and then treat the patient as a whole. Patient is explained everything, because there is no way to increase the thyroid secretion from the hormone. We have only got to supplement. So that is one thing which has to be remembered. Thank you so much. Have a nice day.